These are the body regions and anatomical terminology. Occipital is the back of the head, buccal is the cheek area, oral is the mouth region, mental is the chin, acromial is the point of the shoulder, axillary is the armpit, brachial is the upper part of the arm, olecranal is the back of the elbow, antebrachial is the forearm, pollex is the thumb, umbilical is the navel region, femoral is the thigh, crural is the leg region, patellar is the front part of the knee, popliteal is the back part of the knee, sural is the calf, calcaneal is the heel, and hallux is the big toe. Okay. Now I'm going to demonstrate the directional terms. The head is superior to the sternum, meaning the head is above the sternum or at the upper part of the structure. The olecranon is distal to the acromion, meaning that the olecranon is farther away from the point of connection between the limb and the trunk than the acromion is. The axilla is proximal to the brachium, meaning that the armpit is closer to the point of connection between the limb and the trunk than the upper arm. The nose is medial to the eyes, meaning that the nose is more towards the midline of the body or in between the eyes. The elbow is proximal to the carpus, meaning that the elbow is closer to the point of connection between the limb and the trunk than the wrist is. The sternum is anterior to the vertebral column, meaning that the sternum is more towards the front of the body than the vertebral column. The umbilicus is inferior to the sternum, meaning that the umbilicus is lower than the sternum or more towards the bottom of the structure. The patella is proximal to the tarsus, meaning that the patella is closer to the point of connection between the limb and the trunk than the ankle area is. And the ears are lateral to the eyes, the ears are lateral to the nose, meaning that the ears are on the outside or more towards away from the midline than the nose is. Now I'm going to describe the abdominopelvic regions. Right here is the right hypochondriac region, which has the gallbladder and the liver. The epigastric region has part of the liver and the stomach. The left hypochondriac region has the diaphragm and the spleen. The right lumbar region has the ascending colon of the large intestine as well as the small intestine. The umbilical region contains the transverse colon of the large intestine and parts of the small intestine. And the left lumbar region has the descending colon of the large intestine and the small intestine. The left inguinal region has the sigmoid colon of the large intestine and parts of the small intestine. The hypogastric region has the urinary bladder and again parts of the small intestine. And the right inguinal region has the appendix and the cecum.